In other stories, the Bayelsa state government has flagged off the distribution of essential drugs and basic medical equipment to 105 primary healthcare centers. This was preceded by the inauguration of the 8 local government areas logistics management units before officially introducing Bayelsa State's Tele health initiative. TVC News Bayelsa State correspondent Tele George tells us more.
The idea of a drug mart in Bayelsa was jointly conceived by Governor Siriake Dixon and former Director General of the National Agency for Food and Drug Administration and Control, Dora Akunyili, who passed on before the dream became a reality. On June the 4th, 2013, the Bayelsa governor laid the first blocks to commence work at the site, which, now completed, is referred to as the State Drug Mart for the distribution of wholesome drugs and medicine to 105 primary health care centers.
The essence of all this is to ensure that commodities and drugs and equipment get to all the 105 primary health care centers in the state. And this program is driven by the Save 1 Million Life Performance for Results project.
The testament to government's resolve to revamp for good the primary health care system in the state completely, such that quality health care becomes the currency at the world and local government levels.
The local government logistics management and coordinating units for the second batch of 4 council areas was inaugurated before formally introducing the Bayelsa State Telehealth Initiative at Azikoro village.
Bayelsans to take advantage of the Telehealth Initiative. We use all our platforms on radio and television, even through the social media, to advertise the numbers so that everyone will have access to the numbers.
Whether there are movements of personnel or relocation of infrastructure, that telecom identity remains the same. Secondly, it expands access to care. So that means everybody who has a phone, Nigeria currently has a tele density of 100%. It means virtually every person now has a phone. They can have access to care.
Through this Dial a Doctor, I was able to save a woman from death and then another child from acute diarrhea diseases. So it's a very good program.
My baby was very sick last week, so I now called the line. So the nurse now answered me and prescribed a drugs for me to use on him. Immediately I took those drugs, the problem was solved.
Hello, how may I help you?
The Bayelsa Telehealth Initiative is leveraging telecommunication technology to broaden access to health care. Tele George, TVC News, Yenagoa.